So now, as a part of the continuation of discussion of the ST segment, we have done with the ST segment elevation. Let me discuss the conditions where you have ST segment depression and what is their significance. Now, if you see the morphology of the ST segment depression, the ST segment depression, it can be upsloping ST segment depression, right? You are having ST segment depression, but it is upsloping. Second, downsloping ST segment depression, and third, horizontal ST segment depression. So these are the various forms of or various shapes of the ST segment depression. And one of the very important condition where you have the presence of ST segment depression is in case of the myocardial ischemia. All right, and if the ST segment depression, if it is there for more than or equal to 0.5 mm at J point, right, at J point in more than or equal to 2 contiguous leads, right, in more than or equal to 2 contiguous leads, that indicates the myocardial ischemia, right, that indicates the presence of myocardial ischemia. All right, now you need to be aware of all other conditions where you have the presence of the ST segment depression apart from myocardial ischemia. Now you see this question, ECG shows the drug effect of the digoxin effect, beta blocker excess, norepinephrine excess, the ACE inhibitor excess. Now let me just zoom this ECG, and first let me diagnose what exactly is this ECG suggestive of. Now lead 2 is considered as rhythm strip. By seeing lead 2, we will make out the rate rhythm and as well as the abnormalities first. Okay, so first of all, if you take the rhythm, you are having the variable RR interval, right? Variable RR interval with absent P wave, right? So instead of the P wave that you are having is the fibrillatory waves are present. So this ECG, it is suggestive of atrial fibrillation. This ECG is suggestive of atrial fibrillation. Now, in patients with the atrial fibrillation, the drug what we give for the rate control is digoxin. Now, the ST segment depression that you are having here, it is in a form of an inverted tick, right? This is in the form of the inverted tick, and this inverted tick sign, it is also called as the inverted mustache sign, or it is also called as the hockey stick sign. And where do you come across this? You see this in patients with digoxin effect. In digoxin effect, you have this inverted tick sign. Now, yeah, this is what is nothing but your digoxin effect. So the ST segment which is being depressed, it is in the form of an inverted mustache. So this is called as the inverted mustache sign, right? Or it also called as Salvador Dali sign. Right? Also called as the Salvador Dali sign. Okay. Now, what are all the various conditions where you have the presence of the ST segment depression? Right? The causes of ST segment depression, that includes one, I have already said you, that is myocardial ischemia. And which forms of myocardial ischemia will that be? That includes stable angina, and the second one is the unstable angina. And next, in patients with non-ST elevation MI, you have this ST segment depression. Alright. Next, digoxin effect also you have ST segment depression, and in patients with the posterior wall MI. So in patients with posterior wall MI, you have ST segment depression mainly in the lead V1, V2 and to certain extent V3 as well. Then in patients with hypokalemia, you have the ST segment depression. And digoxin effect, you have ST segment depression. And your chronic stable angina, which is nothing but myocardial ischemia, these are the conditions where you have the presence of ST segment depression. Now, ST segment depression in case of the digoxin effect, we have discussed it as the hockey stick sign also. Yeah. So this is what is your the hockey stick sign. You can see this. You have the ST segment which is being depressed, and here you can just see a ball, right? Hockey ball. So that is why it is considered as a hockey stick sign, right? In digoxin effect, you have the hockey stick sign on inverted tick sign or the inverted mustache sign or Salvador Dali sign. Whereas in digoxin toxicity, so you see in case of digoxin toxicity, in digoxin toxicity, the ECG change that you will have is the ventricular bigeminy. Right, this will be ventricular bigeminy in digoxin toxicity. So ventricular bigeminy in the sense you have a normal complex and then you have a wide QRS complex. Right, you have a normal complex and then you have a wide QRS complex. So this wide QRS complex, whichever is there, right, the wide QRS complex whichever is there, that is what is nothing but your VPC, that is ventricular premature contracture. You see that in case of digoxin toxicity. Whereas in digoxin effect, you have only the ST segment depression. Now, let me show you one more ECG. Yeah. So this is the ECG of a 52-year female patient. She is non-diabetic. She presented with chest pain. And when ECG was done, ECG was showing the ST segment depression in V2, V3 and as well as V4. To certain extent V5, the ECG changes are present. So the chest pain whatever is there in the individual is like the chest pain which is present at rest. This is the ECG suggestive of the unstable angina. Why? Because when cardiac biomarkers are being done, that is the troponin is negative. The cardiac biomarkers are negative. So that is the reason why we can consider it as the unstable angina. Alright, next ECG. Now, if you observe this ECG, I have shown you the same ECG even in case of ST segment elevation also. Actually, if you observe, you are having ST segment elevation in almost all the leads except the ST segment depression in AVR. So what is this ECG suggestive of, where you have the concave ST segment elevation in all the leads except in your AVR? It is suggestive of the acute pericarditis. So in case of acute pericarditis, it is not only ST segment elevation, you also have the presence of right, you also have the presence of the PR segment depression as well. But in AVR, you are having the PR segment elevation. Okay, so this is the ECG suggestive of acute pericarditis, where you have the presence of the ST segment depression in only AVR. Then, now I was just saying you that the ST segment depression is also present in patients with the posterior wall MI. In patients with posterior wall MI, you have the ST segment depression in V1, V2 and V3. And along with ST segment depression in V1, V2 and V3, what is that you will notice is the R by S ratio. The R by S ratio, it is like more than 1, which is suggestive of your posterior wall MI, and the vessel that is being blocked in these individuals is right coronary artery is being blocked. And next important is the electrolyte abnormality. The electrolyte abnormality where you can have ST segment depression is in patients with hypokalemia. You can observe that in hypokalemia, what are all the ECG changes that you have? We have already discussed. That includes the appearance of the U wave. The T wave is inverted. the ST segment is depressed and the QT interval will be prolonged, which is nothing but either QT interval or QU interval will be prolonged, and PR interval will be prolonged. And what will happen to the amplitude of the P wave increases, and that we call pseudo P pulmonale. So even in patients with hypokalemia, you are having ST segment depression. So let me tell you all the conditions with ST segment depression. That is your myocardial ischemia, that is chronic stable angina or unstable angina or non-ST elevation MI. Next, in patients with digoxin effect, not digoxin toxicity, digoxin effect. And the third important condition is like your posterior wall MI, electrolyte abnormalities in patients with the hypokalemia. Then only ST segment depression in AVR that you come across in patients with acute pericarditis. But only thing, ST segment depression in case of digoxin effect, it has multiple names. So you have inverted tick sign, it is also called hockey stick sign, it is also called inverted mustache sign, and it is also called Salvador Dali sign. Okay, so this completes the discussion of your ST segment abnormalities. Thank you very much.